Well, through the pandemic, hospitals have had to use different types of equipment on patients. And joining us now live to talk about that is Dr. Jason Gluck. He is Director of Emergency Cardiac Care at Hartford Hospital's Heart and Vascular Institute. Doctor, welcome back.
Thanks for having me.
All right. So we came to hear about ECMO, ECMO machines for very sick patients. And now we're hearing ECMO On-the-Go. What does that stand for and how does it work?
ECMO is a heart and lung machine that's used to support critically ill patients who are very sick with either lung injury or heart injury. And in ARDS and the flu and in COVID, certainly we're seeing an uptick in people that need it for lungs. ECMO On-the-Go is for patients that are at another hospital that doesn't have this heart-lung machine, and yet they're so sick they need this heart-lung machine. And so we now have the ability to take this technology with us on the road and fly it out by helicopter or come out by ambulance or by jet and bring it to any patient anywhere with the intention of being able to stabilize them in place to make them stable enough to come back to a tertiary care center such as Hartford and then get the needed care they need to hopefully recover.
Wow, what a game changer. All right, so you are the creator of ECMO On-the-Go, and you've been leading a master class in mobile ECMO. Who has been participating in your class? Bring us up to date.
Yeah, so we've partnered with an international organization called ELSO, which is the academic organization of ECMO centers, and we're leading an initiative to train expert ECMO centers to become ECMO On-the-Go centers so that neighboring hospitals that may not have access to this technology can get it. We've been teaching classes already and looking forward to teaching more.
That's great news. Tell us how ECMO actually helps a patient with COVID. Is there an easy way of explaining what it does with their lungs?
Sure. So in COVID, the lungs become so diseased they essentially don't work. And the lungs have two jobs. One is to add oxygen, and the other is to remove carbon dioxide. When the lungs can't really do that, the body can't function. So by adding this external ECMO machine, you essentially add an artificial lung to the patient, which adds oxygen and removes carbon dioxide for the body so that the body can then rest and hopefully recover. And so instead of having to do all the work itself, it has some help, almost like dialysis for a lung.
And real quick, 20 seconds, how long do patients usually need to stay on ECMO with COVID? Do they get better and come off of it?
Yeah, for COVID, it's a long time. So expect to be on ECMO for about 2 weeks or longer. And we hope that most people get better. In our experience, between 40 and 60% of people can recover and get home.
All right, Dr. Jason Gluck, thank you very much. Keep up the good work.